to raise money on their own for his bone marrow transplant. They failed, and he died. Why didn't the state help? Good evening, I'm Ted Koppel, and this is Nightline. When the state of Oregon decided to stop funding most transplants, it allowed this boy to die.
We made the decision that it was better to serve a larger number of children, in essence, which is what we're doing, as opposed to transplants.
Is the cost of modern medical technology forcing public officials to play God? That's our story tonight.
This is ABC News Nightline. Reporting from New York, Ted Koppel.
It used to be a staple of daytime TV, one of the most popular and durable programs ever. Many of you will remember Queen for a Day, but for those of you who don't, the premise was as simple as a soap opera. Women would compete for prizes and a day of lavish pampering by telling their hard luck stories. The audience would applaud each supplicant, and the one who tugged at everyone's heartstrings most effectively got what she needed. It was often touching, frequently painful, and humiliating. But when people need something desperately enough, they will do almost anything to get it. Witness what is happening these days in Oregon. Here's Nightline correspondent James Walker.
This is a story about priorities. Last December 2nd, 7-year-old Kobe Howard died. A bone marrow transplant might have saved him, but he was the first victim of a budget cut in Oregon, a cut that ended state Medicaid payments for most organ transplants.
I'm very, very angry with the state in that they made a decision that they weren't qualified to make. They had no right to make a decision about life and death in 10 minutes with no qualified advice given. And my son subsequently died because of that. They were wrong, and they still are.
Freddie Petit is the state official who decided that if the budget for Department of Human Resources was to be cut, organ transplant operations for welfare recipients would be the first to go.
We made the decision that it was better to serve a larger number of children, in essence, which is what we're doing, as opposed to transplants.
This is the Neonatal Intensive Care Center at the Oregon Health Sciences University. More than 400 babies are treated here each year at an average cost of $1,000 to $2,000 a day. The state pays the bill for over half of them. How can these expenses be reduced? Through good prenatal care. And that's precisely what state lawmakers chose to fund instead of most organ transplants. Oregon officials say 1,600 mothers can be given prenatal care for the same amount of money the state would spend for only 34 transplant operations. They say that limited state funds make the trade-off necessary.
Medical technology has outstripped and will continue to outstrip our ability to pay for it. We have to make choices.
John Kitzhaber is a physician and president of the Oregon State Senate.
The issue here is not, whether we should save lives, and it's not how many will die. To me, it's how many are going to live. The debate on whether or not it's more tragic for a child to die of the lack of an organ transplant or for a child to die in this unit here because they didn't get prenatal care and for a preventable problem, the answer is yes, both are tragic. But we have to take the emotionalism and sensationalism and change it into concern and take that concern and develop a public policy based on the facts.
For Tammy Howard, it is very hard to ignore the emotionalism surrounding her son's plight. With the state refusing to pay for Kobe's bone marrow transplant, and with her son growing sicker, Ms. Howard began a desperate search.
You needed to raise how much?
$100,000.
And you had to raise it in
3.5 weeks, 3 weeks, about.
Last November, nickels, dimes, and dollar bills began pouring in. Portland store owners passed the hat. Some sponsored auctions. Friends held bake sales. Still others sponsored rummage sales, selling skirts, shoes, and dresses for a quarter apiece, coats for $1. Kobe's first-grade classmates sold stickers and pins. But less than a month later, Kobe entered the hospital for chemotherapy treatment. 2 days after that, on December 2nd, he died. The fundraising campaign had fallen $22,000 short of its goal. Even worse, perhaps, Kobe's mother said the last month of her son's life had been horrible.
We were forced into a situation to put Kobe kind of, I hate to use this word, but kind of like a sideshow at a circus, you know. And he knew that, and it bothered him. He didn't like, you know, he would hear on TV about, you know, Kobe Howard, a 7-year-old Rockwood boy who will die of leukemia unless he raises $100,000.
If Kobe Howard doesn't receive a bone marrow transplant soon, doctors say he won't live more than 6 months.
This is what Kobe looked like 6 short weeks ago, and the chemotherapy and drugs have taken their toll.
In 6 weeks' time, Kobe has gone from looking like this to what he looks like today. The chemotherapy and the bin full of pills he takes every day are taking their toll.
We have never been so harsh or black and white about the situation before, you know, where, Kobe, you're going to die.
Kobe spent the last weeks at fundraisers. Often it was the 7-year-old boy who had to pass the cup to try to save his own life.
Kobe was on display. We had to do it. I feel bad that we had to do it. I don't feel bad for doing it because we had to. But
You had no choice.
But I feel bad that we had to, that we were put in a position, I was put in a position to spend the end of his life making a mockery of him, I guess. I embarrassed him.
But was it a mockery?
Yeah. He died. There was no purpose to it now. There was no purpose to spending the end of his life putting him on display.
Don't think I didn't feel very odd trying, asking, begging people for money. That isn't my nature.
Kay Irwin needs a liver transplant within the next 18 months. The state won't pay. Now she and her son have launched a publicity campaign to raise the $100,000 the operation will cost.
We have no time to lose raising funds. And look what happened to Kobe Howard. You know, they ran out of time with him.
This sounds like a very callous question to ask, but are you cute enough? Are you photogenic enough?
Well, let's hope that she's at least $100,000 worth.
Kobe had a very sweet face. The public loved him. People took to him. Kobe's fortunate in that. But there's other people that don't have that sweet a face, that aren't going to get that money coming in from the public.
Kobe Howard has already died. For Kay Irwin, the priority is staying alive. But for the state of Oregon, it's not that simple. Funds are tight. Transplants are too expensive. This is a story about priorities. I'm James Walker for Nightline in Portland, Oregon.
When we come back, we'll be joined by 2 key figures in the Oregon debate over how to set those priorities. Dr. John Kitzhaber, president of the Oregon State Senate, and Mike Kopetsky, an Oregon state representative.
This is ABC.
It's not difficult to see that the debate in Oregon's legislature over funding for medical care is a debate that could be, probably soon will be, taking place in similar legislative bodies throughout the nation. Joining us now from our Portland affiliate, KATU, are 2 people on opposite sides in that debate. Dr. John Kitzhaber, a practicing physician who is president of the Oregon Senate, and Mike Kopetsky, a business and educational consultant in his 4th year as a state representative. Dr. Kitzhaber, I know that the issue was debated in one of the subcommittees, and there was a vote taken today in one of the subcommittees. And from what I gather, at least a preliminary decision has been rendered not to appropriate any new funds for organ transplants. Is that essentially where it stands?
Yes, that's correct. The issue will be revisited tomorrow at the full emergency board, and it could go either way. But at this point, the decision was to not reinstate funding for that program.
I'd like to do something I don't normally do, and that's make a personal observation at this point. I don't think that we can really say that that there's a right or a wrong here, or good guys or bad guys. It's much too easy to reduce the debate to that kind of thing. It is an agonizing decision whichever way you go. But let's start with your point of view, Dr. Kitzhaber, which is you've got to use the money to save the most number of lives. Does that summarize it?
Well, to me, it's an issue of equity. We have a limited amount of money that we can spend on health care in this state and in this country. People on Medicaid, on welfare, have very good health care benefits in general, basically the same kinds of things that people with private policies have. But we also have 140,000 Oregonians at between 75 and 100% of the federal poverty level who have no health insurance and no access to even basic health care services that you get when you're on Medicaid. and another 260,000 Oregonians who have a somewhat higher income but also don't have any health insurance. None of those people have access to organ transplants, nor do many private policies give access to transplants. It seems to me that the question is how best to spend the next available health care dollar that we have in our budget. To me, the issue is one of extending basic health care services to those 400,000 Oregonians who are cut out of the system before we start adding services to people who already have sound basic coverage.
All right, clearly there is another side of the debate, Mr. Kopetsky. What is the other side of it then is what? I mean, clearly all of our hearts hurt when we see someone like Kobe's mother who had to go through the humiliation and the agony. But how do you respond to this? There are limited funds, limited resources, and you can't just, I mean, you can't do it on the basis of a television quiz show, you know, holding the hand over each contestant's head.
And we shouldn't do it that way. I guess there's a number of points raised. Number one is the fact that I believe, as Representative Mason and I believe, I should say, that there is the money in the state emergency fund. There is the money in the ending balance, as it's called here in Oregon, $145 million. If we wanted to direct our priorities, we can direct our priorities, the money, to fund the transplant program. And President Kitzhaber raises the question of how do we fund, how do we spread the dollars for medical services appropriately with limited dollars? Well, you have to start with the question, well, why is it that there is this limited dollars for health care? I don't think that ought to be so in our state or on the federal level as well. There's plenty of money out there if we want to put it into human resources.
Well, now tell me what it is you're talking about there. Are you saying, for example, because if what you're saying is rather than forcing individual patients and individual families to go out literally with cup in hand and beg for the money, that somehow the voters of Oregon in particular and the voters of the United States in general should rather say, look, we are a good and generous people, let's raise the taxes if that's what we have to do. Is that what you're saying?
No, we don't even need to raise the taxes. When I testified this morning before the committee, I pointed out a $2.5 million reservation for natural resources and economic development, money that has not been asked for in the past 7 months. Nobody has stepped forward and claimed and said, these are the projects that this money is for. That's $2.5 million. We only need $738,000 general fund dollars for this, for the rest of the biennium for the transplant program. The money is there.
Now, wait a second. If, in Kobe's case, for example, it would have cost $100,000, the other woman that we saw in the piece also requires.
There's a federal match that comes along with those state general fund dollars at 62 cents for every dollar.
38 cents or 62
correct.
for every dollar that you get. Well, now, Dr. Kitzhaber, if that's the case, why not use some of that other money that's available?
Well, there's no question that we could find money to fund a limited number of transplants. That's really not the issue. The issue is how we're going to spend that money. The 140,000 Oregonians that I mentioned that don't have basic health care coverage would cost the state $250 million a year just to bring them up to the level of benefits that we give to people that are on welfare. We've got 40% of the poor children in this state. 40% of the poor are children. Only 1/3 of them are covered by Medicaid. The other 2/3 are not given access to the system. We have 28 neonatal deaths each year due to a lack of prenatal care. And it seems to me that if we're going to have equity in our health care system, we've got to spend those dollars in a way that's going to benefit the largest number of Oregonians.
Okay, gentlemen, you are losing me a little bit in all these numbers we're throwing back and forth. Let's see if we can clarify that when we come back. We'll continue our discussion in a moment. On Kitzhaber and Mike Kopetsky. Mr. Kopetsky, you and I were just chatting briefly during the break, and even as you were talking to me about the inefficiency of these local fundraising campaigns, we are being inundated by phone calls now wanting to know where people can make donations to the woman who desperately needs money for a transplant. Talk to me about the inefficiency.
Number one, when people raise the money out in the community there, that is not state government dollars, and therefore it is not eligible for the 62-cent federal match. So it's an inefficient use of that fundraising effort. Also is the fact that in that situation you're not getting the state rate of cost of the hospitalization and doctor costs when you do have the transplant procedure. We, the state, get about a rate at about the 75th percentile. Then also you have to examine the question.
Wait a second, you get a discount from the doctors and from the hospital, And you get the matching funds from the federal government. So what, would it be fair to say if you do it privately, it's going to cost about twice as much? More than twice as much.
More than twice as much, that's right. And then also, how many times can a community have these fundraising efforts so that, and it's going to happen, everybody is going to have the sympathy for the Kobe Howards, and rightfully so. So how many times can a community go through that? Doesn't it make more sense to spread that cost out through the state, and you do that by a taxation method?
All right, Dr. Kitzhaber, on the one hand, we're talking about efficiency of using money here. On the other hand, what would you say if I were able to put you on the phone right now with some of these people calling in? Don't waste your money, or this is not the right way to do it? Or would you say to any one of these people who needs a transplant, you know, I mean, don't humiliate yourself this way, or go ahead and do it because that's the only way you're going to get it? I don't know what you tell these people.
Well, I certainly would not discourage anyone from seeking donations to fund an organ transplant. Concerning the legislative decision, however, I think we have to develop a policy that's based on some conscious clinical grounds and has some ethical basis for allocating limited health care resources. And I question a policy, which is essentially what the issue was today when we took our vote, of buying additional services for people who basically have a good level of service, and telling a working mother that we're going to pay for organ transplants for someone on public assistance, but in the same time, we're not going to give your child access to an immunization.
Well, John, Ted, that's not exactly how the program would operate. Even those that, the working poor, those that have health care coverage and are not covered under their health plan for certain transplant procedures, and that's true under a lot of policies in Oregon and throughout the United States, they could become eligible, at least in Oregon, under our medically needy program to have state funding of a transplant procedure.
Well, I'll tell you what, gentlemen, let me just ask you this, and clarify for me, if you would, something that is really confusing me, and that is you, Mr. Kopetsky, were suggesting before that there is money there. You were talking about $2.5 million that's not being used, and other funds that are not being used. And on the other hand, you, Dr. Kitzhaber, were saying to me that there just is, you need $250 million just to meet some of the other medical needs that you have. Which is it? Is there money there in other parts of the budget that could be allocated here, Dr. Kitzhaber?
There is certainly additional money that could be spent on health care if we chose to do it. My point is not that the money is not there, but I would choose, and do choose, to try to take those Oregonians who don't have access to any health care services and try to give them access to our health care system, as opposed to spending money on high-tech medicine for people who already have basic health care services.
Is it totally unrealistic to suggest that under certain circumstances you might be able to do both?
It is impossible to do both in the long run. We could probably do both in the short run. We don't have $250,000 to give all Oregonians access to our health care system. We have limits. We're certainly, you know, we could probably increase the amount of money in the health care budget. We're not going to shut down the system of higher education or close the prisons or let the roads deteriorate. There are other social needs that we have, but I think the ultimate question is, once we've determined the amount of money we can spend on health care, how do we make those choices within that health care budget?
Mr. Kopetsky,
I think we're running away from developing a sound public policy on how to spend it. This is piecemeal. This is reactive public policy making.
Mr. Kopetsky, it seems like a reasonable point. I mean, if you don't do it the way that Dr. Kitzhaber is suggesting, then you do it the hand over the head, who do you feel most sorry for method, don't you?
Well, I think that's what's going to happen out there in the community now in terms of the circus fundraising efforts as it was described. I think that we've got the cart before the horse there in Dr. Kitzhaber's approach. What we ought to do.
Hold on just a second and finish your answer when we come back, because we've got to take a break. We'll continue in just a moment. Name of anyone to whom you can send donations, but at the end of this program, I am going to give you an agency in Oregon to which you can write if you want more information on people who do need money or anything you can do to help them. Continuing our discussion with Dr. John Kitzhaber and Mike Kopetsky. Mr. Kopetsky, before the break, you were just saying we're putting the cart before the horse, and I interrupted you.
That's right. We have the money to fund the transplant program. Let's fund it today. Let's conduct the study. And then if there are parameters around the program that we want in place, fine, let's do it. But what happens if we do the study later? People have died in the meantime, and some of those people fit in the category for whom we would have funded the money.
But others, I mean, again, we are talking, are we not, about finite resources. You can't just...
The problem with that argument is that we're assuming that if we spend $200,000 in this case on transplants, we're going to prevent all the deaths that we could prevent. and we could put a little Band-Aid on the tip of a very big iceberg, pat ourselves on the back, and go home saying we'd solved this problem. We would be ignoring almost 500,000 Oregonians who don't have access to health care. In that population, kids will die of low birth weight, respiratory distress syndrome, whooping cough because they didn't get immunizations, and the only difference is they won't have names and faces associated with them, and you know, we don't have to deal with them. But I assure you, they have names and faces you know, associated with them for their families, and we can't ignore those people. We cannot make public policy piecemeal and in reaction to emotionalism. These are difficult decisions. No one wants to make them, but that's what we were sent to the legislature to do, and I don't think we should run away from it.
Again, Mr. Kopetsky, I come back to the same two words again: finite resources. If
That's right.
You know, there's only so much money in the pot.
There's so much money, but for human resources, and that's part of the debate that goes on not just in Oregon but throughout the country. How large of the human resource pot is there out there? We spend $4 billion a year on Star Wars research. We could fund a heck of a lot of health care programs in this nation if we weren't wasting our money nationally on that kind of program.
Yeah, but then go ahead.
We should probably spend more money on health care, and I agree with you. But once we do that, we're still going to have to make these allocation decisions within the context of that health care budget. And the baseline question is, do we first, as a first priority, make sure all Oregonians and all Americans have access to a basic, compassionate level of health care first, and then talk about high-tech medicine? Or do we add services for a few and leave a large number of people out on the street with no access to our health care system that at least continues to pay lip service to universal access?
Gentlemen, I want to be able to give the name and an address to which people can write. I thank you both very much for joining us. It's a debate that clearly touches all of us, not simply Oregonians. You can write to Adult and Family Services Department in Salem, Oregon, and the zip is 97310. That's Adult and Family Services Department, Salem, Oregon, 97310. They'll give you more information on what you can do to help. That's our report for tonight. I'm Ted Koppel in New York. For all of us here at ABC News, good night.